Maria Rodriguez, a high school teacher from Bakersfield, remembers the day her life changed. Continues previous line. It was a dry, windy afternoon in the fall of 2024. She was refereeing a soccer game, and the Santa Ana winds were kicking up clouds of dust across the field. She didn't think much of it at the time, just the usual grit and grime of a windy day in the Central Valley. Weeks later, a persistent cough settled in her chest, followed by a deep, unshakable fatigue that made getting out of bed feel like a monumental task. Fevers came and went, leaving her drenched in sweat during the night. Her doctors initially suspected pneumonia, then bronchitis, but the antibiotics did nothing. It was a frustrating and frightening time, a medical mystery that was consuming her energy and her spirit. Finally, after weeks of uncertainty and worsening symptoms, a specialist ordered a specific blood test. The result came back positive for coccidioidomycosis, more commonly known as valley fever. For Maria, the diagnosis was both a relief and a source of new anxiety. She finally had a name for her illness, but she was now facing a long, arduous journey of recovery from a fungal infection she had unknowingly inhaled on a soccer field. Her story is not unique. It is a narrative becoming alarmingly common across California, a quiet epidemic spreading through the very soil beneath our feet. This is a public health issue that demands our immediate and undivided attention. Take, for example, John Carter, a construction worker from Fresno. He spent his days on new housing development sites, where the earth was constantly being disturbed. He developed what he thought was a summer flu that just wouldn't quit. The joint pain became so severe he could barely hold his tools. So, what exactly is this invisible adversary causing so much trouble? Valley fever is an infection caused by a fungus called coccidioides. There are two nearly identical species, Coccidioides immitis and Coccidioides posidacei, that are responsible for the illness. The mechanism of transmission for valley fever is deceptively simple and honestly, frighteningly efficient. It all begins with the soil. When soil containing coccidioid spores is disturbed by any means, wind, construction, farming, earthquakes, or even recreational activities like hiking or riding ATVs, the microscopic spores become airborne, mixing with the dust. A person only needs to inhale a few of these spores to become infected. Once inside the lungs, the warm, moist environment allows the spores to change form. They transform into a larger, spherical structure called a spherule, which then grows and eventually ruptures, releasing hundreds of new infectious particles called endospores that can spread within the lungs and in some cases to other parts of the body. The symptoms of valley fever can be incredibly varied and often mimic those of other, more common respiratory illnesses like the flu or bacterial pneumonia. For about 60% of people who are infected, their immune systems fight off the fungus without them ever feeling sick. For the other 40%, symptoms typically appear 1 to 3 weeks after exposure. The most common signs include profound fatigue, cough, fever, shortness of breath, headache, night sweats, muscle aches, and joint pain. The recent explosion of valley fever cases in California is not a coincidence. It is the direct result of a perfect storm of environmental factors supercharged by climate change. The fungus has a very specific preference for weather patterns, a wet period followed by a prolonged hot and dry spell. These conditions allow the fungus to flourish in the soil during the rains, and then, as the ground dries and bakes in the sun, to produce a massive number of spores ready to be carried by the wind. California's increasingly volatile weather patterns, characterized by periods of intense atmospheric rivers, followed by severe drought and heat waves, continues previous line, are creating ideal breeding grounds for the fungus on a scale we have not seen before. The years 2023 and 2024 were textbook examples of this dangerous cycle. After years of historic drought, California experienced record-breaking rainfall, which saturated the soil and promoted a massive bloom of the fungus. This was followed by an intensely hot and dry summer and fall, which desiccated the soil and turned it into a reservoir of infectious spores. One of the greatest challenges in tackling the valley fever epidemic is the difficulty in diagnosing it. The symptoms, fever, cough, fatigue, are notoriously nonspecific and can easily be mistaken for a wide range of more common illnesses. Most patients who present with these symptoms are initially diagnosed with community-acquired pneumonia or influenza. They are often prescribed rounds of antibiotics which are completely ineffective against a fungal infection. A definitive diagnosis of valley fever typically requires a specific set of tests that a doctor must consciously decide to order. The most common diagnostic tools are blood tests that look for antibodies against the coccidioides fungus. There are two types of antibodies, IgM and IgG, and their presence can indicate a recent or ongoing infection. The problem is that awareness of valley fever, even among healthcare professionals, can be surprisingly low, especially in areas where the disease is newly emerging. Therefore, patient advocacy is incredibly important. If you live in or have recently traveled to an endemic area like the Central Valley or other parts of the Southwest, and you develop persistent flu-like symptoms, you must be your own best advocate. You should explicitly ask your doctor, could this be valley fever? This simple question can prompt the necessary testing and shave valuable time off the diagnostic process. While it's impossible to completely eliminate the risk of inhaling spores while living in an endemic area, there are practical and effective steps you can take to significantly reduce your exposure. The core principle of prevention is simple: avoid breathing in dust. On windy days, especially during dust storms, it is best to stay indoors with the windows and doors closed. If you have a central air conditioning and heating system, make sure you are using high-efficiency particulate air, or HEPA, filters, and that they are changed regularly. These filters are designed to capture microscopic particles, including fungal spores, and can dramatically improve your indoor air quality. When you must be outdoors in dusty conditions, particularly if you are involved in activities that disturb the soil like gardening, yard work, or visiting a construction site, wearing proper respiratory protection is key. A simple cloth mask is not sufficient. You should use an N95 respirator mask, which is certified to filter out at least 95% of airborne particles. It is important to ensure the mask fits snugly on your face with no gaps, creating a tight seal to protect your airways. The silent epidemic of valley fever is getting louder. As we stand here in August of 2025, the confluence of climate change, population growth, and land development in California has turned a regional health concern into an escalating statewide crisis. We can no longer afford to treat this as a niche disease confined to a few dusty corners of the Southwest. The spores are on the move, carried by the winds of a warming planet. This response must be multi-pronged. We need to invest more in research to develop better diagnostic tools, more effective treatments with fewer side effects, and, ultimately, a vaccine. A vaccine for dogs is already showing promise, which gives us hope that a human vaccine is an achievable goal. But government and scientific efforts alone are not enough. The most powerful tool we have right now is awareness. We must educate the public and the medical community about the risks, symptoms, and prevention of valley fever. Every person living in or traveling to an at-risk area needs to know what this disease is, and to ask their doctor about it if they develop symptoms. The fight against valley fever is a fight on the front lines of climate and health. It is a clear and present example of how changes to our environment can have profound and direct consequences for our well-being. This is not a problem that will solve itself. It will only worsen if we choose to ignore it. We must take this disease seriously. We must fund the science, spread the knowledge, and take the simple, practical steps to protect ourselves and our families. The health of California depends on our ability to see this invisible threat and to act decisively before the dust settles on a far greater public health tragedy.